Greetings, my name is Adam Abadir, the Communications Director for the Baltimore City Health Department. It's my pleasure to also introduce Benjamin Young-Savage, our Social Media Consultant and Creative Director. The COVID-19 pandemic challenged our public health agencies across the country, but our ability to communicate clearly and effectively in an age of organized misinformation was a particular concern for the Baltimore City Health Department communications team. For the majority of 2020, communications were focused on introducing new concepts to Baltimore City residents to prevent disease transmission: social distancing, mask wearing, and washing your hands. However, after a year of these campaigns, our followers on social media began reaching out for advice on how to have harm reduction conversations with friends and family members who, for any number of reasons, were not inclined to follow the latest public health guidance. Shorty, pull your mask up, a quip given at a press conference by Baltimore Mayor Brandon Scott to community activist Shorty Davis, whose mask had fallen from his face, provided an opportunity. After watching this interaction go viral, we realized that by introducing harm reduction best practices using authentic language and a dash of humor, we could arm our followers with information that followers could then share with friends and family members, both on social media, but also in group text threads and real-life conversations in order to influence decision-making and model behaviors. Conversations with BCHD epidemiologists, contact tracers, data analysts, and community canvassers gave us insight into what specific behaviors, activities, and beliefs were contributing to increases in new cases and later slowing vaccination efforts.
We also use information freely shared to us by our detractors on social media to create campaigns that targeted specific misinformation about what could prevent COVID-19 transmission. Salads, green tea, and ginger ale, all unfortunately are no substitute for getting vaccinated. Through memes and engagement in comments across our social media, the Baltimore City Health Department establishes a voice for itself and for the city. While always being willing to educate and provide information, we also push back on trolls, distinguishing between individuals who have questions and those who decided to do their best to hinder the healthy habits of Baltimore City residents. Baltimore has a unique character, one of grit, but also one of compassion. We look out for each other and band together to face our common problems. Our tagline is Baltimore versus COVID, and that's exactly what we mean. A common problem will require all of us to support one another. We reserve the right to clap back with love, snark, and maybe a gif or two on those individuals who purposely chose to sow doubt on public health best practices and the importance of vaccination. In doing so, we draw a line in the sand. You can try that with other public health agencies, but it won't fly in Baltimore.